Good morning from WKYT News. I'm Bill Bryant, and we welcome you to Kentucky Newsmakers. A little later, we'll continue our interviews with the candidates for Lexington Mayor. Former Vice Mayor Linda Gorton will talk about why she's running. That is coming up later. But first, Kentucky's Justice and Public Safety Secretary John Tilley is here after he told lawmakers this week that Kentucky is headed toward running out of prison space and may eventually have to release thousands of inmates early. Kentucky's opioid crisis is fueling other crimes that are clogging up the courts and the jails. Right now, the budget proposed by Governor Matt Bevin cuts educational funding, including to universities, and shifts more money to prisons. In his previous job as chairman of the House Judiciary Committee, Secretary Tilley championed House Bill 463, and that redirected the trend of filling up prisons with low-level offenders at the time. Secretary Tilley says the number of prisoners is now likely to go up, something that we'll likely have to deal with as early as next year. Mr. Secretary, welcome. Very tough place to be. We have a drug epidemic that is not letting up. So many people are being sent to prison. We're running out of space. And then there's always this question, can you really lower prison population at the same time you lower crime rates?
Well, you absolutely can. And in fact, most would tell you there's very little correlation between the two. However, 31 states have now done just that. Over the past 7 to 8 years, when that we saw a time previous to that when all state prison populations were exploding across the country. Certainly Kentucky at that time was #1. This was for the decade ending in about 2010. we were leading the country and the world, frankly, Bill, in prison growth. We are no longer leading the world in prison growth, although we are now we've creeped back into the top 10 in terms of per capita incarceration. We're #2 in the country for female per capita incarceration. Some would say without the reforms of 463, which you mentioned, we would be between 30 and 35,000 inmates today. We're now at 24,000, but we had closed 4 facilities after 463. We've reopened 1 now. That was a private prison. We're heading in the direction to open 2 more. And that's why we'll be out of space by May 2019. There's really no other way to say that.
So you agree with those who say our current strategy is not working? Right?
No, I agree. In fact, I've been saying that for quite some time. What we've seen is this dramatic increase in incapacitation of low-level offenders. In other words, incarceration. Class D is our lowest felony class level, and that's where we've seen the most dramatic growth. These are oftentimes drug possession cases. We have nearly 1,000 offenders serving time in prison on drug possession alone. Many states have gone away from incarcerating drug possession offenders at all. States like West Virginia, Tennessee, Oklahoma, other states have done this very thing. We'll be looking at maybe changing the way we treat drug possessory offenders this session. That'll be a decision for the legislature, but that's really what's driving our population. It's addiction. Bill, let me say, 24,000 inmates today, over 18,000 of them have a substance use disorder. We're not talking about releasing anyone who has a violent criminal history. We're not talking about looking for alternatives to incarceration for sexual or violent offenders. We're talking about low-level, non-violent offenders.
Well, why are we not effectively dealing with that? Why are those folks not getting the treatment they need to get away from that addiction so that they are not in prison?
Well, I think we've done a good job in this state. The irony here is that Kentucky is seen as a state which is leading the country in innovative drug policy. That doesn't mean we have enough treatment slots. No state does. The Surgeon General issued a report last year, 18 months ago, that said across the country only 10% of those addicted have treatment. I mean, can you imagine someone with diabetes or heart disease only having a 10% chance of treatment? Well, that's where we find ourselves. I think it's probably a little better in Kentucky. We frankly have some unused beds. We have to do a better job communicating unused slots as well. It doesn't always have to be a residential treatment opportunity. It can be an outpatient opportunity. They are very effective at a fraction of the cost of a residential setting, but we are working like never before. There's an announcement. We'll have an announcement today on a treatment locator so that judges and others will know exactly where to find treatment beds and slots. We've got to do a better job at that. We've increased treatment capacity in our prisons alone by over 1,000% in recent years. We've worked hard to do that, and I think I'd like to be back before you next year to say we've increase that number twofold.
If we get to the point where low-level offenders are not incarcerated, you do always have concerns within communities about crimes, even if it is burglary and theft. Police will say they get frustrated by, you know, the old saying, they beat us back to the police station.
That's right.
Being released. I mean, do you have to weigh a lot of factors?
You do, but let's be honest, when I hear that, I understand there's frustration, and listen, nobody works harder. I mean, public safety is our #1 job at the cabinet, and the governor is intensely focused on that, as am I. And we have done everything we can for law enforcement. We certainly are working with them and want to, but the idea is to get these low-level offenders, the very people that are frustrating them, is to get them treatment, get them clean and sober, get jobs, transportation, help them reenter society so we don't see this kind of recidivism rate that we have in Kentucky, which is well above the national average.
What has changed since 463, which I think was 2011?
That's right.
When you did that work. And again, we reversed the trend line. We were on track to have 30,000 people incarcerated
by 2015.
Right, and it went the other way. Now something has changed and it's turned around. Totally the drug epidemic?
Not totally, but certainly that's the biggest factor. No one saw this opioid crisis becoming a pandemic in the way that it has. We can see it in our numbers here. Also, the fact that there's still some resistance to implementing the bill. There's a lot of discretion built in for those in the criminal justice system to say, I'm not going to use these options. I'm going to go with a different route. And there's also the parole grant rate. We've got a good parole board now, but we've been at times, we didn't have full strength there, and that's about 20 percentage points off. So where the population was predicted to have a certain parole grant rate, that parole grant rate is now hovering much lower than that at about 40%. That was unexpected.
Where are we relative to other states?
It's not good. We're back to top 10. We're 10th in per capita incarceration. I'd like to be 50th. We're 10th. We're 2nd in female per capita incarceration. Kentucky has the highest percentage of children who have had or have an incarcerated parent. We have a record number of kids in foster care. So when you talk about the cost of corrections, let's say $650 million, well, that doesn't tell the story of county jails. You know, the 76 county jails that are operating at well over capacity, what it means to those county taxpayers. That's their #1 budget concern. That doesn't tell the story of what kind of strains it places on our health and family services cabinet, the social workers, and the foster care system, which is in crisis. So this is a children and families issue first and foremost.
The U.S. Attorney General Jeff Sessions visited the state this week, and he seemed to be saying that treatment is not working, and seemed to be indicating that, at least at the federal level, that incarceration is going to be the answer going forward.
Well, for violent criminals and for those who are commercially trafficking in drugs, I could not agree more. And I would say that every study suggests that treatment does work. Correctional officers actually see treatment working inside our prison walls. That culture has changed. A few years ago, you might have a CO, a correctional officer, working behind the walls that was resistant to these programs that are in place, and now we're hearing, and I'm talking to them myself, they see the benefit of treatment, and studies suggest that treatment absolutely does work. What doesn't work is incarcerating someone who has a disease that is criminogenic, that makes them worse, that creates a better criminal. When they get out, they have a felony on their record. They know how to do certain things to survive that eventually land them back in prison. So again, there's room to disagree there, but I do have great respect.
But is there a cohesive strategy going forth where the feds and the state are kind of on the same page? I
think there is. I've been to a meeting at the White House. And of course, our governor had a follow-up meeting with the president. He talked about the need for criminal justice reform. There's a commission that we've discussed, where we've had these discussions with. I think to the extent that there is some disagreement, I think, in Washington over this. But, I think those would tell you that the criminal justice reform package of 2016 that did not get a vote was extremely close to getting a vote. At least we got the Comprehensive Addiction and Recovery Act, which moved through Congress and is a very good piece of legislation, needs funding. That's the problem.
What do you want to see done in this session that will make a difference? We've
got to have these reforms. We have 22 recommendations from a task force, a bipartisan, multi-branch group. Every stakeholder in the criminal justice community came together and made 22 recommendations to the legislature to act on. You'll see a bill filed. Got some very dynamic bill sponsors. Chairman Nemes in the House. It starts with him first, but Kim Moser and I think maybe Senator Gilearchy Adams will work on it as well in the Senate. But and Whitney Westfield, of course, will do some work on it. But there's 22 recommendations. Not all of them will likely make it, but they will only avert 80% of the growth. So I think the legislature has some choices to make, and these aren't choices that are beyond a reason. I mean, these are choices that legislators have made in Texas, in Georgia, in South Carolina, in Utah. Very, very conservative states, and a lot of the reform efforts are coming from states which are right of center and conservative, and groups like Right on Crime are leading the way nationally because it is good, sound policy. Whether you're a liberal, a moderate, or conservative, you can agree that we need criminal justice reform. That's why our governor has been a national leader on this front now.
Mr. Secretary, about a minute left. The Marshall County school shooting, a reminder of how vulnerable our schools can be. The administration, the Bevin administration was right, of course, to praise the first responders, and of course you oversee Kentucky State Police. Obviously drills made a big difference, but what are we doing to prevent the next one?
Well, let me say this, all you said is exactly right. Great response by first responders. Proud the state police, the training worked for the students in that school. We have got to come together as a state, again, continue to prepare for this kind of thing. It won't be our last, sadly, I don't think. I hope it is. We need to continue that kind of training for the kids. We need to work on mental health in our state. We've not funded that properly from the federal or state level. I mean, and again, we are trying. We've got to work with law enforcement to understand what drives this, and we got to quit using jails and prisons to treat those who have behavioral health problems.
Mr. Secretary, thanks for coming. Appreciate it. John Tilley from the Justice Cabinet. Now, we're back with the former Lexington Vice Mayor Linda Gorton, now a candidate for mayor, in just a moment. Hello again from WKYT News, and good morning. I'm Bill Bryant. We're glad you're on Kentucky Newsmakers. The dust is still settling from last week's wild race to the finish line for candidates running in the 2018 elections. When it was all said and done, there was a crowded field of candidates for Lexington mayor. The May primary will narrow the field down to 2 candidates who will then face off in November. The candidates include former Lexington Mayor Teresa Isaac, as well as former Police Chief Ronnie Baston, Councilman at Large Kevin Stennett, also Skip Horine, Ike Lawrence, and William Wayman, and former Vice Mayor Linda Gorton. And Linda Gorton is joining us today, and we appreciate very much you coming in. As I said, has the dust settled yet? I'm not sure.
It's settling.
Well, we welcome you in. Is it fair to say that you are surprised by this large field of candidates?
Well, I'm not too surprised, and I think it's great for Lexington. It's wonderful that we have so many people who are willing to commit themselves to run for public office. It's a good thing.
And you've expressed to me that you generally respect most of those in the field that you know.
Yes. There are a couple of those candidates I don't know, but otherwise the ones I do know I respect very much. I think it's a loaded field. It'll be fun.
All right. Did you surprise yourself when you heard that the Mayor Jim Gray was running for Congress and you decided that you would enter this race?
Well, I retired from the council.
Right.
It took a little time to refocus and see what I wanted my priorities to be. And so this was not on my to-do list, but I think I've been led to do this because of my strong leadership background. And I feel really good about it. I wouldn't say I was surprised, but I'm in a good place right now.
You, by career, were a nurse. In fact,
Yes.
you said you still have your license.
Yes, I've kept my license active.
And for many years on the City Council, representing First Year District and at large and as Vice Mayor. What is it that you believe that you would bring to the Mayor's office that would benefit the city most?
There are a couple of things. I do have a very strong background in leadership. And the way I lead is I like to bring people together. I'm very big on people. That's what it's all about, is working for the people. I have a great history of bringing them together to collaborate, to work through problems. I think problem solving is one of my strengths, and if people look back to my service on council, they will see that. So these are qualities that a mayor needs, because it's not all an easy path. And a mayor needs to be able to go to the people and bring them together to solve whatever the problem is.
I have heard people make this observation since you filed, and that is that Linda is a quiet person, and yet she gets all these votes, and has won election after election. And even some who have supported you are somewhat mystified by your appeal to the voters.
Isn't it great?
How do you explain it?
Well, I am a people person. And so my campaigns are always people focused, and I love meeting people right in the neighborhoods where they live. I love hearing what their concerns and problems are, and I think that's what most people want in an elected official. They want an elected official to hear them. I may not always vote the way they think I should, but if I'm willing to listen to their position, that's what people respect. That's what they want. So, I mean, I can't explain it all, but you know, I like getting in there and getting busy with people.
But you're telling us that when you know, rubber meets the road and
Yes.
a meeting is maybe getting out of hand, you have no problem slamming the gavel and
Oh, I have
restoring
no
order.
problem. No problem at all. People will tell you that.
The city is often at a crossroads when it comes to growth and development issues versus preservation and history. All are important to the community.
Yes.
How do you approach what can be a very contentious arguments about that?
Well, here again, I think bringing people together. We know that Lexington is a very special place, and we know that we've had a tight growth boundary since 1958, the first one in the whole country. And so we, as a community, are very big on planned growth. We should not give that up. We need to continue planning, and the way to do that is to bring different stakeholder groups in to figure it out. And we have a good path forward on that. The council approved goals and objectives that sent to the Planning Commission a forward look to form a process whereby we'll know we're filling up inside the boundary, and now we need to see if we're checking off the marks to go forward.
Do you generally support extending the urban services boundary when in your judgment that becomes necessary?
Well, first of all, I'm a huge supporter of the urban service boundary, and I think we need to finish our infill and redevelopment efforts. We've got to fill in. We've got a few thousand acres inside the boundary that are not filled in. It's very expensive to expand the boundary and run services out to whatever area we want to grow, sewers, roads, et cetera, et cetera. So we have to be really careful when we do decide that maybe a certain piece needs to come in. So people know I'm a very big supporter of our boundary and smart planning before we ever expand.
When you're doing infill, obviously people can come in with money and invest in a neighborhood, and all of a sudden the property values shoot up, and some who live there and have been there a long time have difficulty paying the taxes on the new assessments that they get. Is that a concern?
It is a concern, and I think it leads directly to the issue of affordable housing. We have to be sure in Fayette County that we do not price people out. There are a couple of communities around the country who have done that, so it's a huge concern. We need to keep looking at affordable housing.
Lexington is in many ways a prosperous and diverse city. Education levels are relatively high here, but there is a real gap in the haves and the have-nots. The homeless problem, probably the worst in the state, worse than Metro Louisville, which has twice as many people. Recently, a homeless person died in a camp. near a busy shopping area. How would you approach the homelessness issue?
Well, we have done some really good things. When I was on the council, we established the Office for Homeless Prevention, and we have a good, strong leader there. It's really important for the city to work with the nonprofits in the community who are also interested in helping the homeless problem. The faith community is critical. It's something that I think government can't fix it all by itself. We've got to come together. You know, the homeless problem is, I think, in a way very similar to another huge problem we have, and that is the drug situation, the opioid abuse. They are community problems. They're not problems that are segregated to one particular area, and they affect everybody. They don't just affect a certain person.
And public safety, obviously a major challenge for any city. As you mentioned, the EMS groups are running hard to these overdose situations. A record number of homicides last year, seemingly random shootings are frequent. The police department's the largest it's ever been.
Yes.
How do you get after crime in the city?
Well, I believe that I'm really glad you asked this, because as I'm looking at the different issues that I would like to address, right at the top is crime, which is directly linked to the opioid crisis. Our community has got to face this head on, and it is a crisis. I mean, I've been studying a lot about it. The Centers for Disease Control say that drug overdoses are the #1 killer of people under 50. Under age 50. These are people who normally you think are in jobs, they're raising families, they're starting families, they're in the, you know, the heart of their lives, and they're dying because of these drug overdoses. They directly affect the crime rate. And so one of the things that I want to do when I become mayor is to establish a commission that will involve healthcare perspective, insurance, public safety, the faith community. We have got to fix this, or it will, you know, it will continue to get worse.
What kind of jobs would you like to see the city attract? You know, it's long been a place that didn't welcome a lot of smokestack industry and heavy industry, but yet many are concerned when they see plants locating in surrounding areas and not within Lexington proper. How do you approach that, or does Lexington need to look at more regionally at the job picture?
Well, I think it's a multi-pronged approach. Lexington we need jobs. We always need to bring in jobs because, as you know, our city's budget is heavily based on the occupational license fee. It's not based on property tax. So what I believe we need to do is have a strategy to go after high quality, high paying jobs, and along with that, we have to have job retraining. You know, there was a recent article, I think the Stanford folks are looking at the future of robots. I mean, this is very interesting. By 2030, many jobs in our economic scene will be gone. They'll be done by robots. So Lexington has to look at what we want and how we can retrain folks to take the new jobs. So we need a strategy, an all-encompassing strategy. I don't think we want just any jobs, Bill.
Final question, it may be one of the most important ones. Crisis management.
Yes.
A mayor never knows what's going to happen in a day's time.
That's right.
And rough things can happen. Ice storms, snowstorms, other things that, unmentionables.
Yes.
How would you handle a situation like that? And how can people in the city be assured that you're prepared for that?
That's a great question, and it's important because we know of mayors who've taken office and then there's an immediate crisis. I've been trained. I'm a professional registered nurse. When I first went into nursing, I worked several years in intensive care. We had crises every day. I have dealt with crises in my own family where a family member suddenly had an event, and I'm pretty cool and calm in a crisis. I like to go, I'm a very common sense person, and I will function very well for the public. I'm not a person who tends to get excited or, you know, panicked or anything like that. It doesn't do any good, and it's not my personality anyway. So I will be calm. I'll rely on experts in the situation, and we'll move forward, whatever the crisis is.
Linda Gorton, former vice mayor, now candidate for mayor of Lexington. Thank you for coming.
Thank you for having me.
We'll see you along the trail.
Okay, thank you, Bill.
And we're back on Kentucky Newsmakers. And a reminder, over the next few weeks, we'll be scheduling candidates for Lexington mayor and other offices during what is likely to be a busy election season. We're staying on top of the legislative action as it happens in Frankfort. Join us for coverage on WKYT News, our website, WKYT.com, and here on Kentucky Newsmakers. And we'll see you bright and early this week on WKYT This Morning, on WKYT Mid-Morning at 10, and WKYT News at noon. Make it a good week ahead.